speaker, Professor Yaneer Bar-Yam, who is founder and president of New England Complexity Institute. In the field, we can say for him, he's kind of the rock star of the complexity studies. So in the name of our association, I'm so honored to have he's in our conference. And now I don't want to take his time anymore. And Professor Yaneer Bar-Yam, the floor is for you. Thank you.
Thank you very much. So I'm sorry to hear about the earthquake and the losses that have happened. And of course, we are in a time of tremendous tragedy in the world. And it's a difficult time for everyone to both to understand what's happening and to make effective decisions, including, as we know, the challenges for leadership. And I understand that this is the topic of the conference. Let me discuss a little bit both the domain that we are part of, the science of complexity and chaos, and reflect on the challenges for leadership and, unfortunately, the failures of leadership in the context of this outbreak. I think there are two very different kinds of messages. One is the message of understanding the behavior of systems, the dynamical behavior of systems. We've seen over and over again that it's hard for people to understand exponential growth, how a disease propagates in a society, that the idea that if you don't do anything, things don't remain the same is hard for people, right? Because everyone expects that if you don't do anything, then the same thing will happen over time. But when you have a disease, doing nothing is exponential growth. And understanding that at any level of the number of cases that you have, you will still get the exponential growth. So if you start with a small number, you get exponential growth. Start with a large number, you get exponential growth. It's hard for people to understand. So very basic dynamical understanding of systems is hard. There's, of course, one number that's different, and that's 0. If you have 0 cases of transmission, then you still have 0, no matter what the R value, the multiplier per day, the infection rate is. So again, there's a very big difference from 0 and any other number. And this is something that people have a hard time understanding intuitively. It's not their usual way of thinking about the world. And this is, of course, part of how we think about dynamical systems that leads to study of chaos. And in chaos, we know that systems can be unpredictable. And at the same time, if we understand the control parameters, then we can still control them. And this is exactly what we're facing when we're facing the coronavirus outbreak. People have a hard time grappling with the fact that we cannot easily predict what's happening. We don't know exactly what's going to happen. And indeed, under these circumstances, prediction is less important than control. Because the whole point is that the objective is to control the outbreak. And to control the outbreak, it's more important to understand the control parameters than it is to make a specific prediction. So what we've seen again and again from the beginning of the outbreak is that people want scientists to predict what's going to happen next. Tell me what's going to happen next. But prediction is kind of the opposite of control, right? Because if you control, the prediction is a result of what you're going to do, not standing by itself. And this is hard for many scientists, epidemiologists, to understand, because they're not dealing with the social action. They're dealing with the disease dynamics. But if you deal with the social action with the disease dynamics, then you have a system that we can choose what happens. And in fact, there are countries that have been very successful at choosing what will happen. Of course, it started with China, but then now we have very good examples with Australia and of course Taiwan and South Korea and New Zealand were very successful at making a decision and achieving the outcome that they wanted, which was to eliminate the virus, right? Because if you eliminate the virus, then you can go back to normal. Everyone in the world would like to go back to normal. The problem is that there is a delayed effect, right? If you want to get back to normal, you first have to control the outbreak, and then you can get back to normal. You cannot be in normal with the disease propagating in the society. And so this is the challenge for people to understand, because everyone says, well, let's just go back to normal. No, it doesn't work. It hasn't worked multiple times. It didn't work in Europe when Italy said, hey, let's just pretend it doesn't exist. It didn't work throughout Europe when they said, hey, let's pretend it doesn't exist. And eventually things became bad enough that they took action. But when they improved somewhat, they said, okay, let's start going back to normal. And of course, that didn't work either. So this is a challenge of leadership. It's also a challenge of communication about what's happening. Leadership has an important role, not only in understanding things, but also in communicating it to others so that they will understand what the society as a whole, in this case, it's also true about companies, is doing. So the first responsibility is to understand. The second responsibility is to share that understanding with others. And in order to do so, one has to recognize what's important and what's unimportant. And this brings us to the second part of the understanding of the system. The first we said was the dynamics. The second is complexity. Complexity has to do with having many different things going on. There's a lot of different parts of what's happening, a lot of different aspects, which means scientifically a lot of different variables. And you can think about all of the things that people talk about and realize that most of them are unimportant. And so the challenge in complex systems is not actually to deal with all of the many different variables that are important, but to recognize which ones are important and to focus on those. And the mathematical strategy for doing this originates in renormalization group in physics and in multi-scale analysis more generally, where what you do is you look at the largest scale, most important variables. And in fact, those are the control parameters that we have to regulate the behavior of the system. So the understanding in the complexity space, if you will, is to narrow what one has to pay attention to focus on the most important dimensions, and to use that to create a framework, which is sort of a model, right? But a framework for the specific model that enables us to do the regulation of the system. And in the case of the coronavirus, the variables that we need to know are very few. First of all, to know that disease is a terrible disease. And again, when any disease or any illness or any way of harm is affecting only a few people, it's not a societal challenge. But when it grows exponentially, no matter how many few we start with, we will end up with having so many that it will be unbearable. And that is what the challenge that we've faced is, that there are a few cases and people say, oh, it doesn't look so bad. And then a few weeks later, it's horrendous. And we've seen this over and over again. And now in Europe, they are suffering the overwhelming of hospitals, the devastation of disease and of death. And once again, a few weeks ago, people were saying, no, it's not so bad. You know, we don't see, it's not that important. We can all be all right. And that's just not true. So the first thing to understand is that the disease is a terrible disease. And I haven't yet even mentioned, well, it's become clear in the last few months that there is a long-term disability that arises from the disease. That the many cases, even asymptomatic or mildly symptomatic, of young people and old people leads to heart damage, brain damage, kidney damage, loss of male fertility that's expected to happen. And the consequence of this for society as a whole is terrible. But surely also for people who have said, hey, it's not that important, I'll be okay, they're discovering, unfortunately too late, because it's irreversible, that it's very bad. And this irreversibility, by the way, again, is a mathematical thing that we need to understand. The departure from reversibility is not only a psychological problem, it's a mathematical issue. When we talk about distributions and we think of them as equilibrium distributions instead of as distributions that have irreversibility, non-ergodic behavior. So people will unfortunately have and will experience this irreversibility and won't be able to redo the decisions that they made before. And the best we can do is to recognize that it's still true that this disease is a terrible disease, and that the best thing that we could do is to reduce it as much as possible, and this is possible, to eliminate it. So the first thing is that it's a terrible disease. The second thing is what I talked about before, is that it grows very rapidly, exponentially, is something people have a hard time understanding. And the third thing is that we can eliminate it. And eliminating the disease is something that I've been told many, many times is not possible. And in fact, I've been told this for years. I've been talking about pandemics for 15 years, and I worked on a policy level on Ebola in West Africa and on a community level in Ebola in the Congo, in the DRC. And we learned two things. One is that despite the scientists, the epidemiologists claiming that you couldn't eliminate the disease, you could. We stopped it after 10,000 deaths, which was huge. It was 10 times as many as had happened before with this disease. But it was 1/10 of 1% of what people were predicting would happen. which was 10 million deaths. So we can stop the disease. And then the second question is how? And the answer brings to light the second aspect of leadership that I wanted to talk about. And that is that it turns out that the way to stop a pandemic is in the place where the pandemic happens, not in the hospital, not in the doctor's office, but in the community. Pandemic is a disease of the community. It's not a disease of an individual. To talk about a pandemic of an individual makes no sense. An individual is sick, a community has a pandemic. And the community has a pandemic because it transmits from individual to individual. So if the disease is a quality of a community, it is a community responsibility to take action, ultimately. And this creates a challenge for leadership. Leadership that is removed from the community through layers and layers of hierarchy is disconnected from the problems and the thoughts, the aspirations, and the desires, the needs of the community members and the community. And in order to overcome this challenge, we have to restore communities to having responsibility and ownership of their own well-being. And in the outbreak of Ebola in West Africa, what we discovered is that the communities themselves took action. So I was advising in the US and the UN to go into the communities and to detect cases early to stop the outbreak. And it was very hard to get the government to take action. But in the middle of October, I was given the number of someone in West Africa by a friend. And I called them up and I said to them, how are you doing? What's going on? And they explained to me. And then I said, well, what about trying this? And they said, oh yeah, we started doing that 3 weeks ago. And so in the middle of September, they had started going door to door in the community to identify temperature as an early symptom of the disease and isolating people based upon temperature. And the community action stopped the outbreak. It was them. They had their own neighborhood teams, people of the neighborhood that went door to door. And that's what stopped the outbreak. And in the Congo, I was involved in creating community efforts to do this. And the message that I have is that leadership at any level can serve to engage with the community, but it is the community itself that has to take responsibility and ownership for eliminating the outbreak. And that message has become clear in pandemics over history, and a leadership that is disconnected from the community. And this is a challenge that we've faced over and over again around the world, in the Western world, in the developed world, and in the developing world, in much of the developing world, is that there is a disconnect between leadership and the community. But there are places that have done dramatically better. And again, it's not just Taiwan and China, it's not just New Zealand and Australia, it's very poor places, and of course, wealthy places. It is island nations, it is main countries. Senegal has done an outstanding job in Africa. Many African countries have done much better than Western developed countries for two reasons. One reason, along with those countries in Asia who have taken strong action, is that they had experience in Asia with SARS, in Africa with Ebola and other diseases. So they knew that they had to take this seriously and act aggressively, respond effectively and with intention to get to zero. and to open up normally and not to try to live with the disease. And the second is that they understood that the center of the action is in the community, and that it requires many different people working together with different skills and different capabilities, and taking responsibility for having community interactions with the medical system that are strong, having community interactions with leadership and governance at all levels that's strong and supportive. It's in a crisis, in any crisis, it's always a time where the strength of the society is being tested, the strength of the relationships and the caring that we have for each other is the key to our success. This is my summary of what's been happening. In specific, we know that it really is hard to get rid of the outbreak, but the hardest thing is to make a decision to do so. And if one makes a decision to do so and puts all of one's strength and capabilities behind the effort, then it is possible, and it can be done within not a long period of time, really within weeks, and with border controls, one can open up to normal. One of the things that I didn't say that I should finish with is that I mentioned that we need to know what's important, what are the relevant variables technically in any problem. And I mentioned the severity of the disease, the speed of the disease, and the fact that we can get rid of it. Those are three important things. But the variables that we need also are, as I said, the discreteness of variables. So 0 is different from other numbers, and geography. And geography is super important because the central tool that we have is creating zones and bringing each zone to 0, and then protecting it and expanding rapidly other zones, because it's a lot easier to stop a disease in one local area than it is to stop it everywhere. If we divide and conquer, if we divide the country, if we divide the world, of course, through countries, through localities, through urban areas, and through neighborhoods in urban areas, we can much more easily stop the disease. And all we have to do is to limit non-essential travel between zones. And this was done in zones in China, in New Zealand, in Australia, where within urban areas, travel was limited. Between provinces, travel was limited. And the success that was achieved demonstrates that that strategy is crucial. We have a paper that's coming out to explain this a little bit more mathematically in the context of outbreaks, but the concept is what's most important, because if we do it, we can be successful. And it doesn't have to be perfect. It just has to be understanding what are the control variables that we have for success. Let me stop there and allow, let's do questions, because I would like to know what is on your mind and what I can help with.
Professor Yaneer Bar-Yam, thanks for your speech. Dear participants, you can send your questions through chat and question answers part of the Zoom platforms. Before start to taking questions, I'm using my advantages as a moderator. I have two questions, Professor Yaneer Bar-Yam. First one is, as you mentioned that, because I'm also following your previous work related with Ebola and how it's controlled. I would like to ask that, how do you see the differences when it comes to the leadership and crisis management compared to Ebola and right now COVID-19 pandemic?
So Ebola was limited to a few countries, and each country was different. And, you know, there's an importance of understanding that it's possible that with Ebola, you would think that people would react. It's a much more severe disease. 50% of people die. And with Ebola, with the coronavirus, it's only a few percent that are dying of cases. And so you'd think that with Ebola, people would treat it much more seriously. But with Ebola also, there were people that said, no, this is fake. There are people who are injecting us with Ebola in hospitals. You know, all of the denialism and so on is present. At the time, people said, oh, that's just in Africa. It wouldn't happen if it was someplace else. But of course, what we've seen from the coronavirus is these challenges are global. I think you know, and the other thing is that, you know, people talk about one of the things that has happened with the coronavirus is that everyone says, you know, there's this trade-off between health and economy. You know, we can't shut down the economy because the economy will suffer and so on. And it's become clear, and it was obvious from the beginning for people who think about this through, that in order to have the economy recover, you have to stop the outbreak. And the IMF has said this recently, the International Monetary Fund in their October report, and there are other analyses like from the Boston Consulting Group, and more businesses are getting to realize this, that you cannot have economy thriving with a disease that's this bad. But the same challenge was also happening with Ebola. People were saying, no, we can't stop flights, we can't stop travel, we can't stop travel from this place to this place, because if we do it, then, you know, the economy will suffer, and so we can't do that. So many of the same things were happening. It's very easy to look back at Ebola being stopped in West Africa and saying, oh, the reason is because of this, the reason is because of that, the reason is because of this. And the answer is, many of the same things happen, a little bit different here, a little bit different there. The coronavirus is much more rapid in its transmission. Ebola was multiplying by a factor of 2 every week, the coronavirus by a factor of 10. It's a very, very different rate. And that allowed Ebola, we had a little bit more time to react to it, a little bit more time for people to build the community efforts that were successful. And then, you know, yes, we didn't have quite as much of, you know, people saying, well, it's only old people that get sick. It's only old people that die, which is, of course, not true. The young people are getting long COVID. They're suffering terribly from it. And not everybody, but of course, 50% of people was with Ebola too. So the point is the following. It's actually much more similar than people think. The fact that coronavirus is a respiratory disease is part of what makes it transmit more rapidly. There are some asymptomatics, which was much less with the Ebola, and that makes it more difficult to stop it. That's why we need, systematic lockdowns of urban areas. But overall, it's much more similar. And again, SARS is the disease that's most similar to the coronavirus. And SARS was also stopped and eliminated. Doesn't exist. And it was stopped and eliminated. Again, today we still have people say, no, you can't eliminate it. It's a different disease. It's airborne, it's asymptomatic. No, it's possible. It's been done in multiple countries. And indeed, the most similar disease, which is SARS, was stopped.
Thank you, Professor. I received few questions because some of our participants watching from YouTube channel, it's on leave. One question comes from our symposium chair, Professor Şule Erçetin, and she asked that how you evaluate the general lack of meta governance in the case of the fighting against COVID-19, because it's obvious that there is a kind of lack of consensus between countries, World Health Organization, and even the countries basically just criticizing their measures and other things. So how do you see this lack of meta governance while fighting this COVID-19?
So this is a big issue. We had the same problem with Ebola. The UN, WHO, CDC systems have not given the right guidance. And I do think that it's somewhat the same issue as what we've talked about in leadership. There is a disconnect between those organizations and really the people that are at the center of this problem, which is the people in communities, in urban areas. They think they're helping, and there are individuals that are doing the right thing, but they're not clear about what's the most important thing. Remember, we talked about what's the most important things. They don't have complexity, science, and chaos to guide them. They don't understand the mathematical description of what's happening that provides clarity. And they don't have, again, these two pieces. One is the clarity about what's important. The importance of travel restrictions has been debated by WHO for years. And it's only now that they're beginning to accept it, but not to promote it. And recently they were against lockdowns, and all of a sudden everyone has to do lockdowns because they don't understand that the dynamics requires you to lock down in order to suppress, in order to control the outbreak. And there is this confusion about the economics, and this has become clear. Economic discussion should be transparent, and the mathematics is unambiguous. And the data at this point is unambiguous. It all says, eliminate the virus and then open up, because we cannot live with the disease and have a thriving economy. And so if we try to live with the disease and have a thriving economy, we're suffering and suffering and suffering and suffering. And if we eliminate the disease, it takes us a strong effort, a heroic effort, a focused effort, an all-society effort, but it only takes a few weeks. There is no other solution. There may be a solution in years, but even what people talk about in terms of vaccines have always been done in conjunction with isolation of people, in conjunction with efforts that reduce the transmission by the society. Without the combination, to rely on a vaccine it just doesn't work. And we've seen that with the vaccine for Ebola in the Congo. They did ring vaccination with smallpox, with every other disease, that with very few exceptions, vaccines are an adjunct and not a primary means of disease suppression. It will be a long time before we have enough vaccine. Even if the vaccines work, it'll take a long time to get there. So we need to realize that solving the problem now is super important, and taking strong action is super important. So I hope I answered the question. I've gone off in their directions.
Yes, definitely. I mean, we have another few questions if you still have time. One of our participants, Dr. Selim Kanat, asked that, do you think, Professor, are the governments doing their best about managing crisis? What would your advice for managing this pandemic process?
When we talk about business leadership, the important things, the central things are setting goals, being clear about what the objective is, having a plan for execution, and then executing on the plan. Governments don't know how to do that. And the academics that are advising the government, including epidemiologists, they're not real-world deciders. So we need to have people who understand, and the business community, if anything, could be the solution to that problem by providing advice to the government, not about the disease, but about two things, about inspiring people, right? And about execution of tasks. And the inspiring means having a goal and not saying, hey, you know, let's do this or we'll react to that. It's all reactive, right? When something happens, then we'll act. Yeah, it's like you watch this thing coming at you and you wait until it smashes you in the face before you do something about it. Doesn't make any sense. You have to anticipate, you have to have a goal, you have to plan, you have to execute. All of those things are things that in business we know how to do, and government doesn't have a clue. So we cannot expect the existing leadership in government that's really mostly good at, I don't know, finding, you know, I don't know, fighting political battles, getting attention, things like that. It's totally different than setting a goal for society, for an organization, which really is a society itself, executing on a plan and getting to the goal. And the other part of this is knowing how to act in the face of uncertainty. In the real world, wishful thinking is a terrible thing. Now, a lot of what we do as individuals in the real world, we write stuff in the hope that it'll get published. You know, if we didn't have wishful thinking about what will happen, we probably wouldn't do a lot of what we do. But in the face of a catastrophe, wishful thinking is not a good thing. You can't say, well, maybe the disease won't be so bad. Or you know, or maybe if I play Russian roulette, I won't get killed. You know, that's not the way you deal with the real world. So decision-making under uncertainty is a missing domain in the scientific fields in academia. And it's an essential part of dealing with a pandemic. So leadership should understand that there is a need for good decision-making under uncertainty, should establish goals, even aspirational goals. It may be hard to get there, but it's worthwhile. And we have to set it up and execute. And for that, business can help, military can help, the institutions that are around that have different skills can help. It's an all on board, everybody doing it. And again, the main thing is to make sure that the community understands where we're going, understands what the reward is of going back to normal. And so they decide that this is something that they want to make sure it happens.
Thank you, Professor. We have one more question. Dr. Nihan Potas, she's also a member of organizing committee and expert of biostatistics. She said that, she asked that, when we analyze the initial data from the COVID patients in the beginning of March and May, they noticed that some of the patient algorithms is quite different compared to the first wave and second wave now. And she asked that, will this changing algorithms related with the COVID-19 patients will increase the complexity structure of pandemic and how it reflects upcoming solutions?
So I'm not sure I understand. What is different about the patients?
Basically the data, some data shows that using the pills are not working very well. Actually, the data shows that. But
the medications are not working very well. Yeah. So so the challenge that we're facing is that medicine and medical advances happen on a time frame that is long compared to what's going on. What we can do is within days, we can take weeks. If everybody self-isolated, if everybody said, I'm going to take a vacation, I'm going to stay at home. In fact, I'm going to stay away from my family members for 14 days, the disease would be gone. There is no medical knowledge that we can develop that is faster than that. So the point is that the societal action is actually the fast action, not the slow action. The medical advance is slower. The vaccine is even longer. So the challenge that we face is to realize that time matters and to focus on the things that we can do quickly first. And the medical advances have helped. It's not that they haven't helped. They've probably reduced the fatality rate by maybe a factor of 2. The avoiding ventilation in favor of proning, using some trial medications, particularly steroids, has helped. So there's some decrease in the severity of cases because of improve in knowledge of care. But it hasn't changed things by an order of magnitude. Whereas stopping the disease, the prevention should be done. And this is one of the challenges of Western medicine today. Western medicine is all about treating and not about preventing. It's prevention, and again, prevention happens when you're well, not when you're sick. And so doctors don't see well people. It's not what they do. I mean, yes, a little bit, but it's really a very small part of what they're focused on. They're super focused on, you know, if you have a heart condition, if you have a, you know, if you have needs for surgery or something, that's kind of where they find their comfort zone. And helping people to change their diet or this, that's something that is hard for them. It's outside of their comfort zone. And then even more, again, is the community. And we recently had a conversation. There is a book called Getting to Zero about the Ebola outbreak in Sierra Leone. And the people that wrote that book, a physician and a diplomat, they are also just as clear as I am. It's the community. And the physician said, it's super essential for us to realize that we need to bridge between the medical people and the community. And that means focusing on the health of the community, the health of individuals in the community, which is where the transmission takes place. And so if we realize that that's the center, and we shift our lens from saying, well, what happens to an individual is in the hospital, which is what the medical system is doing, right? We have these sick people in the hospital. Do we intubate them? Do we prone them? Do we give them this medication or that medication? And if the focus of attention shifts, not everyone, because we still need to treat people, to the community, then all of a sudden the people in the hospital go away. That's how we cure them, by preventing them from being sick in the first place. And remember that we have a very high leverage, because instead of exponential growth, we can get exponential decline. And Turkey has done this, and many countries in the world have done this, and it got down, and then they said, oh, okay, I guess we're down, we'll open up, we'll restart the economy, because the economy has to function. We can't just keep going this way with the economy shut down. And the store owners say, oh no, we have to open up our stores, otherwise we'll be in trouble. And then of course they open up, and they can only open up a little bit, and then all of a sudden the cases explode, and then all of a sudden we have to shut down again, and it's terrible again, and we can't do this. Oh, we can't do a shutdown, but we have to do a shutdown. So the really central thing is to understand dynamics. Going back to chaos, going back to dynamics. A year ago, people believed that a disease would never cause them to disrupt their lives. Normal would continue. Now, everybody believes, or most people believe, that the normal that we have now will continue. The disease will always be around, and so we have to find a way to accommodate it, to live with it. We have to mitigate it this way. We have to do something this way so that the economy can open, even though it's just not true. The thing to understand is that in a few months, we could be like New Zealand, like Taiwan, like Vietnam, like China, wondering why this was such a problem in the first place. Because we've gotten rid of it. Yeah, there's other questions.
I will combine two questions, and because the timing is also coming to end. One of the participants asked that, is it possible to say that all leadership approach needs revision after the pandemic breakdown? And another participant asked that, would you make a predict for ending the pandemic, like a specific time and date?
So the first statement is, yes, we need a change in leadership, but we need a change in the societal understanding. It's not a change of individuals. It's also a change of the structure of what leadership looks like. And that's super important. And including the understanding, and including the understanding of community, including the understanding of the need for people to work together rather than to have individual leaders. All of those things are important. Sorry. But the second question, would I make a prediction? Well, we just said that it's a chaotic system. So it really depends on our decisions. And so instead of asking, would I predict? My answer is always, this is what we need to do. If we do this, then we can get rid of it within weeks. If we take strong action, and I haven't spelled it out in detail, though we can. It's not that long. First of all, people have to realize that it is a community effort. Everyone has to be on board. So we have to talk to people with respect and with recognition that it's a shared effort to engage in this challenge. The second thing is that we need to prevent transmission by staying away from people and not touching shared surfaces and wearing masks. That's the prevention. And then if someone gets sick, then we have to prevent them from transmitting. And that involves isolation away from home, away from family. And so it has to be supported isolation where people are cared for and feel comfortable where they are away from home. And then they have to do quarantining of the other people, right? And we have to do testing so that we don't have to do as much of the isolation as otherwise we would have to, and contact tracing, and find the people to quarantine if there are people outside of home. All of those things are part of preventing transmission from people who are sick. And then we have to have the travel restrictions, preventing people from going to community so that we can rapidly decrease. People say, if you have a flood, first turn off the tap. You turn off the water coming in so that you're dealing with the water that you have and not more that's coming in. So you have to stop cases coming in by border control and community protection once you're back to zero. And then you have to watch about safe essential services The companies that do need to be open have to be safe as much as possible. And then you have to worry about high-risk institutions like nursing homes and prisons and any place else where there's shared living facilities. And finally, you have to make sure that hospitals are functional and have the facilities they need and are protected so that we can get the care that we need. All of those things, but it's only a few things, are what we need to do. So what I've said from the beginning is we are 5 weeks away from being out of this from the moment we do the right thing. As soon as we do the right thing, 5 weeks later, we will be fine. Any other questions?
Professor Yaneer Bar-Yam, we don't have other questions. It's a great pleasure to have you in our conference. Once more, I would like to express my gratitude and thanks to accept being our keynote speaker. And I would like to thank on behalf of my associations, other partners from Bosnia and Turkey. And lastly, I would like to thank on behalf of the participants who cannot watch the beginning, you can watch on the YouTube and our websites later. Professor Yaneer Bar-Yam, thank you again.
Thank you very much. Be well.